Hi, I'm Dr. Catherine Wood. I'm a gynecologist in Frisco, Texas, and I've been in Frisco since 2002. I'm here today to talk to you about the P-shot, or the Priapus shot. I want to ask you if you're suffering from any of these conditions. Have you noticed a decrease in sensation with relations? Have you noticed a lack of firmness? Have you noticed a problem maintaining that firmness during sexual relations? Also, have you noticed any changes in size, which can be a normal response to aging? Another condition that some men suffer with is called Peyronie's disease, and it's an abnormal curvature of the penis. This can cause erectile dysfunction and it can cause pain. I also want to mention something called lichen sclerosus, which is a skin condition of the penis. And then finally, have you noticed suffering in your relationships because of these issues? So I'm here today to talk to you about the P-shot and introduce you to that. It's called the Priapus shot, which is a very simple procedure that can be the answer to all of these erectile dysfunction issues. Erectile dysfunction is actually way more common than you might think, and especially more common as men get older. Many times this can be due to cardiovascular conditions. It might be the first sign of cardiovascular disease. It can also be due to medications that you might be taking, like blood pressure medications, antidepressants, other things that affect it. Sometimes we don't always know the reason, but we do know that there are some answers, some very simple things that can be done to help correct this. The benefits of the P-shot are tremendous. For men, they're noticing an increased desire, increased firmness, and they can also have more sensation with relations. It definitely helps improve the size and girth of the penis in most men, and because of all these things, it's going to improve your relationship with your partner. The quickness about it is great because you could come in on your lunch hour, have a P-shot, return back to work, and that evening you could have sexual relations without a problem. The P-shot procedure is very simple. What I like to do first is to meet you and do a complimentary consultation. I want to review your medical history, especially for any history of cardiovascular disease in the family, and to see if you've had any issues with cardiovascular disease. The other thing is we will review your medications, blood pressure medications, antidepressants, other medications may be causing a problem and affecting your sex life and affecting the penis, causing erectile dysfunction. After the consultation, I'll bring you back at another visit. During that time, you'll come into our office, Dermalase Face and Body Men, and then we'll get you started on your treatment. We'll apply numbing cream to the penis. It will be on the penis for about 20 to 30 minutes, and it's a very strong numbing cream. While you're numbing, we're going to draw your blood. Now, the reason why we draw the blood is to obtain this very awesome substance called platelet-rich plasma, or PRP. PRP has been used for years with orthopedic injuries, sports injuries, treating arthritis, and what PRP does is actually stimulate stem cells and growth factors and new blood vessel formation in the areas where it's used. So the beauty of this procedure is we're using your own body's ability to heal itself and correct the ED, the erectile dysfunction. So as we're preparing the PRP, this is done with a centrifuge. We put the blood in it. It takes about 15 minutes to spin, and on the top is this golden layer of platelet-rich plasma. That is then drawn off, and we're going to use about 10 cc's of that to inject into the penis. We also use a P pump, which is placed on the penis right after the shot for about 10 minutes, and we like you to take that home and use it at home for 10 minutes twice a day. The other thing I would like to mention is that our office uses another procedure before the P-shot is given, and it's a Gainswave procedure. So what Gainswave does is use a gentle shock wave treatment to stimulate the penis. So when we do the Gainswave before we do the P-shot, we're actually getting a better procedure with more lasting results. So who is a candidate for this procedure? Really, any man with any level of erectile dysfunction can be helped with the P-shot. I definitely think I would consider that before trying any major surgical procedure to correct this problem. And I also want you to know that you are not alone, that many men have this condition, and many are afraid to talk about it. Sometimes it's just a natural course of aging. But I want you to know that there is help. This is a very simple procedure, and that many men have had great success with it. So call the number on the screen and access my website and make an appointment today. I want to get you back on the road to your usual vim and vigor, to restore your relationship and help you, because that's really what it's all about. Call the number today and schedule your complimentary consultation. We'd love to see you. Thank you very much.